My name is Sherry Guess, and this is the Heavily Meddled Podcast. On this podcast, I interview patients, medical professionals, and industry insiders, having important discussions regarding the all too commonly experienced but lesser identified symptoms of hypersensitivity to metals contained in implanted medical and dental hardware, diet, and environments. These metals often cause a variety of dysfunctional immune responses, chronic pain, and other syndromes that fly under the radar of most patients and physicians. During these interviews, the patients and I discuss ideas for managing symptoms, share personal lifestyle modifications, and talk about how to advocate with and educate providers pre- and post-surgery, along with options found for implant removal and the how-to of adverse event reporting. This podcast does not give medical advice. From time to time, I may interview medical professionals that render personal opinions you can use to follow up with your individual provider. Let's roll. Hello, metalheads, and welcome back to this edition of the Heavily Meddled Podcast. Super excited that you're here with us today. Today, we are trying a first, well, several firsts, actually. First, a disclaimer. It is hotter than hell where I live in Texas. It is 107 degrees outside, which means it's 80 degrees where I am recording, and I have been, sweating like a pig all day long, makeup running. So if you see me glistening and dripping sweat, there is literally nothing I can do about it. So that's the first. The second first is our guest today, Maria, is joining us, not on camera. She is choosing to remain anonymous, but she is definitely wanting to share her story about the Essure contraceptive device and allergies and symptoms she was having from that implant. And I'm going to let her tell most of her story. But if you're tuning in on audio, this isn't even going to be a thing. If you're tuning in on video, you get to see me sweat and you get to see Maria's black screen. And that's just how it's going to be today. So we are glad you're here. Maria, welcome.
Thanks so much for having me.
Tell us a little bit about who you are and a little bit about your background, your family. And before we get into your story, share with us who you are.
Yeah, so I come from a pretty large family. I'm a proud mother and I'm a wife. I'm into education.
Very nice. You had gotten in touch with me. We met and you had a pretty interesting Essure story. I don't know much about your story, but I'm going to be here learning right along with our guests. So why don't you go ahead and start from the beginning?
Well, my husband and I, after we had what we felt like was probably going to be our last child, I was speaking to my doctor and I had all my children naturally as far as vaginally. I didn't have to have C-sections or anything like that. And in hindsight, it's pretty ridiculous. But at the time, I had never had surgery in my life and I didn't want to have surgery. And the way that the process worked for me was that if I had decided to do some sort of permanent birth control, it would not have been done at the time of childbirth, and I would have to come back and have to have full-blown surgery. And like I said, hindsight's 2020. If I could go back, I would definitely redo that. A couple of scars on your tummy is nothing compared to what I would deal with for the next decade. So
right.
At the time, though, that was really the selling point is, hey, this is quick, easy, relatively painless. It's non-surgical. So you don't have to, and it costs $50.
Really? $50?
Yeah, $50.
$50 to make your life miserable for a decade.
Yeah, $50. Of course, I had insurance, so I'm not sure what anybody else would have paid if they had not have insurance, but I'm sure Medicaid or something would have picked up and probably paid all of it. So that was really inexpensive. And the big selling point for me was no surgery, no scars, no surgery, no readmission to the hospital. And you can go to work the next day. So it sounded like a dream come true. And I thought, let's do it. You trust your doctor. I've learned a lot about that. And unfortunately, I've lost a lot of faith in the medical community, which was really hard. I'll talk about that probably a little bit later because that was such an obstacle for me in this process, a hurdle that I didn't anticipate. And it took me a while to really, really get over that. I can't say that I'm over it now. It's kind of like a violation of trust in a really intimate relationship. I don't know that you ever get over it because these are strangers and they're not personally invested in your life. And you thought that they were. So that was really difficult. Anyway, that was the selling point. So I said, sure. So it was actually less than a month later, I came back to have it done. And this particular situation, they did not do it in the hospital. It was done in a secondary clinic. So I went in that morning, and of course they say non-surgical because it is non-surgical. There's no cutting. There's no putting to sleep. It's done vaginally. I was told, okay, there might be 30 seconds of discomfort, maybe a minute. And really outside of that, I trusted and I was like, well, okay, I think I can bite the bullet for 30 seconds. I can do this. I don't want to be a sissy. This will keep me from having a crazy recovery in the hospital. Having my abdominal muscles cut. I can do this. So I go in there and the first thing they did was they gave me a pill. It was Valium. And I'm guessing it was to chill me out. At the time, I didn't know a lot about medicine, but they gave it to me and they wanted to wait a minute and let it get in my system. And so I waited. I was like the only person in that waiting room. And they came to get me and I said, I'm not ready. Like, I'm fully coherent. I'm awake. I don't feel a thing. And I think it's because I was so nervous. I was really scared. And
which is why they gave me the Valium.
Exactly. But the crazy thing is I'd never had Valium before in my life, and I'm very sensitive to drugs, and it didn't work. I don't know if I was just so stressed. I don't know. But she looked at me, and the nurse did, and she looked at the doctor and she said, she's completely coherent. What do you want to do? And she said, well, give her another one. Give her half of another one and make her walk to get it in her system, like get it pumping, in her blood. So they're like, okay, we're going to give you another one. And I think at that time they decided to give me a hydrocodone, something to go ahead and be in my system for pain. And they said, walk. We need you to walk for 30 minutes. So I just walked around the waiting room for 30 minutes trying to get that medicine, pumping. And about 30 minutes later, she came in and she said, are you ready? And I said, no, I'm not ready. I'm awake and I'm not ready. And they walked towards me and they kind of grabbed my arm and very gently. And they said, we're going to take you back now because your speech is very slurred. And what was bizarre is I didn't even hear it. I was completely unaware. And they took me to the back into a room. And when they opened the door, to my left was a tray of, it looked like torture devices, honestly. It was a lot of knives, a lot of sharp objects and things that looked very painful. And when we walked in, the doctor kind of scolded the nurse because I saw it and it took my breath away because I didn't know what type of instruments were going to be used. And I just kind of gasped a little bit. I stopped and she scolded the nurse and she said, you're supposed to have that covered up. I told you to cover that up. So then they put a towel or whatever they put over their tray of tools. I'm sure for sanitation purposes as well, but also so the patient doesn't see. And it took me in the small room. It was really the size of an examination room. And there were several people in that room. I think there was probably at least 4. And they laid me down on a table. So I'm completely awake, completely coherent. At this point, though, that Valium really kicked in and I couldn't really move very well. It chills you out enough that you can't really do anything. So they turned off the lights. They dimmed them significantly and they turned on classical music. And I think it was just to try to calm me down. And there was a nurse standing near me. And oh gosh, I didn't think I would get emotional. Sorry.
No, I understand. You take whatever time you need.
Sorry. I'm laying on the table and there's a nurse standing close to me. And I just started crying. And I said, I'm going to need you to hold my hand. And she said, yes, absolutely. I will hold your hand. And I want to say there was one on the left too. And then there was 2 down at the other end with a doctor. And I think in hindsight now, it's because people were doing these and they needed to watch other doctors do them so that they were trained on how to do it. I'm assuming, after all the things I've studied and researched. Usually there's a lot of people
I'm
in the
missing
room.
something. You said there's two on the other end. Two what?
Two nurses, I'm assuming.
Okay. There were multiple people in the room.
There was like 4 or 5. She talked like she had done a ton of them, and I do think she had, but I don't think she did them very often. So I think people came to watch in order to learn how to do it in their offices when they had one, if that makes sense.
Which is interesting because you can't see anything since it's a vaginal application. But that's just like my 2 cents.
True, but I guess just being in the room with it being done, I don't know, because there's like a certain number of clicks for you know how far up they go.
Right.
Anyway,
you're educating me. I literally know nothing about Essure.
Yeah, they use this tool, and it's these small metal coils. And essentially, they're shoving them up vaginally all the way up through your uterus into your fallopian tubes. They go past your cervix, up your uterus, and into your fallopian tubes. So it's pretty far up there. Once they get that tool up there, the only thing I can think to liken it to, I think, is kind of like a tampon, you know, where I hate to say this, but when you're putting in a tampon, you have to push it. So this particular machine, you push it so many clicks to get the coil out of the machine and pushed into the tube.
Okay.
And it's a slightly jagged coil. So this is not a nice, smooth insertion. It's meant to aggravate the fallopian tube and cause scarring. So it's sharp. Jagged.
So when they told you it was painless, not quite so much.
She said it was going to be essentially like 30 seconds of pinching, like a nice pinch. And I can't say that I completely disagree. It was more than uncomfortable. It hurt. I mean, I cried. And once you get through one side, they have to take it out and do the other side because you have 2 tubes. So, you know, probably at least 2 minutes, 60 seconds on each side. And this is going to sound so odd, but I'm just going to say it because it's my experience. When I was a child, I saw a movie or a piece of a movie called If These Walls Could Talk. I don't know if you're familiar with this. I think Cher was in this movie. It is incredibly old. The premise of it, so incredibly young, but I walked in the room in a scene where they were doing an illegal abortion on a table in a living room. And that's what I felt like.
I was going to say, when you started describing this to me, that's what it sounded like. I'm like, that doesn't sound like birth control. That sounds like an abortion clinic.
Yeah.
I didn't want to say that, but since you said that, that's exactly what I was thinking.
Well, I flashed back to when I walked in that room and whoever was watching that movie, that's the flashback I had. It took me back to that moment as a child when I just saw a snippet of that movie. And that's exactly what I felt like. And so it was a strange feeling because it felt like it was in secret. And I don't know, there was an odd vibe. So when it was over with and done, they went and got my husband to come and get me. And I leaned up on the table and I saw a lot of blood. I don't know if that's uncommon or not. And they basically was like, okay, we're done. You can go home and relax. You can go eat, take a nap, and go to work tomorrow. And we'll see you later. So
any follow-up scheduled? No, just that was it?
There is a follow-up. 3 months later, you have to have an ultrasound to make sure that the scarring completely closed your tubes at a hospital. I don't remember going back to my doctor until much later, but 3 months later, you go and have dye shot up in there. So you're not supposed to have sex for 3 months to make sure. I think my husband, when he walked in, like I said, when I leaned up, I had saw a lot of blood. And I think when he came in to get me, I just could see his face and it was kind of almost like pity. I think he knew I just went through something that was quite difficult and he wasn't in the room. And he was walking me out and he said, "Are you okay? Do you regret it?" And I just remember, you know, it's odd. And I'm sure a lot of women could probably relate. Like what he was saying was, this is permanent. This is forever. And this was legit forever at the time. And even a couple years later, you couldn't even have this reverse. Like no one could help you. You would never have children again, even if you changed your mind. So I think he was asking me, how did I feel after I know now I can no longer ever give birth? Like, and it was a sad moment, but I just got in the car and like moved on. It was weird. It was like 30 minutes and yeah. So, we really didn't know much about, just went on with life. I went and did the dye. Everything was fine. But it wasn't long after that I was incredibly fatigued. And I'm a really hard worker. I grew up as a hard worker. I've worked my entire life. And I have a really high energy level like my mom. So I have friends who joke and say they don't understand how I can get it all done, work a full-time job, raise a big family. I cook dinner every night. I have a very clean house. And they're like, when do you do this? So even when I was fatigued, it's going to sound strange, but that's why other people really didn't notice it. I didn't talk about it. But even when I was fatigued, I was still outperforming or at least a normal level of energy because I'm just so high strung. But I was very, very tired. And my husband was like, you're abnormally tired. You're coming home and you're taking 3-hour naps after work and you're getting up and then you're going right back to bed. So I finally made an appointment. I think it was my yearly, and I go to her. Very kind. I have to say, my doctor has a wonderful bedside manner. She delivered multiples of my children. That's why I think it was so painful, because she was a part of my life. I went to her and she was very kind and considerate. And she just said, you're a working mom with several children. It's normal to be tired. I don't fault her for that because she's right. I mean, I'm working crazy hours. I have a lot of children. And then I have like 7 other things that I do in the community.
Since the procedure, from the procedure to the dye test, did you have any symptoms at all? Or you just went on with your life? No pain, no symptoms, no nothing?
Honestly, I don't have any recollection of that time period. It never entered my mind that anything could go wrong, ever. So naive, but I really did trust that, they knew what they were doing and they're there and they'll be with me for life. It never even registered to me.
Okay.
Other than being tired, I don't recall a symptom. But I did start having problems within the first year. Like I said, I didn't make a connection to that. But I was starting to take 2 to 3 hour naps after work. I'd get up, I'd cook dinner, I'd go back to bed early, and I'd sleep all night. So my husband was concerned, told me I need to go get blood work done. So we did that. She told me all my levels were good. It was normal to be tired, and I just dismissed it. That was within the first year. The next year, and I have all this documented, so it's easy for me to actually remember this. I went back through photos. I went back through other things that I'd written down in diaries when I didn't know what it was, but I'd written my daily experience or whatever. So I have a lot of documentation for that reason. I'm a writer, so I write. And the next year, I had this incredible rash that just came up all over my face. And I always had really great skin. I didn't have any issues with acne. I didn't have any of that. It was like over 100 bumps on my face. It was just crazy. And it was like immediate. And then it just kind of went away. And I thought that was bizarre. I went to visit a family member and I happened to take a photo with them. And that's why I have documentation of that particular reaction. And, many, many, many moons later, I've learned that that was a reaction or a common side effect to nickel. But keep in mind, at this time, I didn't ask. I didn't know what these coils were even made of. I wasn't told what they were made of. I didn't know to ask what they were made of. I just blind trust.
You said you found out that they were made from nickel.
Yes.
Did you have a history of nickel allergies and jewelry allergies, or not at that point?
No.
Okay.
I still don't have any allergy to nickel. I had a childhood friend that actually did have an allergy to nickel and silver. So I'm familiar with it. When her belt buckle would touch her skin, it would blister almost immediately. It was strange.
But you did start having symptoms from the Essure. Do you think it was a metal reaction and just too much of it because you've never had one in the past? Or do you think it was just a foreign body reaction from the Essure?
I think it might have been a little bit of a combination because I learned later, and I was going to talk about this a little bit later. The ridiculous part of the whole idea is that they have these coils in there. Their idea is it's going to notice it as a foreign object. And these coils are like springs, but with jagged edges. And so the fallopian tubes would scar through the loops and close. So essentially you're aggravating a part of the body, causing it to collapse and try to get rid of it. The problem is, even when it closes, it doesn't stop attacking. So it triggers autoimmune disorders because you are in constant fight mode. Like your immunity is just constantly going to that area because it is in constant irritation. So I definitely think that triggered other things because I started to have other symptoms as the years went by. It was like a new symptom appeared every year.
Mm-hmm.
So no,
did you
I
ever
don't
have a
have
metal
any.
allergy test?
No, I did not. No.
Okay. So you actually don't know. You just have not had a nickel reaction in your past, but you did
Right.
have some kind of reaction to the metal implant that could be
Yes.
nickel, just maybe in a higher concentration, right? So we haven't necessarily ruled it in, but we haven't ruled it out.
Yes.
Got it.
Absolutely. So I started having that rash. And then the same year, I started vomiting uncontrollably one weekend. And you think, oh, I got a stomach virus. And I was taken to the ER and they had to do an MRI of my abdomen, which I learned later you're not supposed to do if you have metal in your body. But what's crazy is on the forms, when you go to fill out forms at the doctor or hospital or the dentist, anything, the little box that says, have you ever had surgery? Well, if you've had Essure and you've never had surgery, you click no because it's non-surgical, which is a major loophole. I mean, that's a big problem because doctors don't even know to ask you if there's something in your body.
Yes.
Because whatever's in there is put in surgically. And so I found out later that's a big deal. Like, I think it could have been caught earlier, but people didn't even know that I had anything in me because I always checked the box no to surgery. They couldn't really figure out why I was vomiting or anything like that. It was very bizarre. And then the headaches started. And I'm not a person that has headaches. So that was really bizarre. And the longest headache I had was 28 days straight.
Oh my gosh. Prior to Essure, were you healthy in general? Did you have any pre-existing health issues at all?
No, I had none. I took no medicine. I did not have headaches. A young, healthy adult. I never really had anything where I needed to take medicine. I didn't hurt or anything like that. But I had this horrible headache. I started getting headaches. And I had this headache that lasted 28 days. And I was at work. And I actually had to lay on the floor. And they had to call someone in there, and it was my friend, and they were like, we need you to take her to the ER. So she took me to the ER from my job, and I waited in the ER for like 8 hours, which was a disaster. And of course, they did scans and stuff, and they couldn't find anything. They were scanning my brain, my head, and they couldn't find anything. And they said, we have no clue, your head, your brain, they look fine. We don't know why you're having these headaches. And they just sent me home. So the headaches continued. And then I started having really bad lower back pain. One day, I was walking into my bedroom. I had the worst abdominal pain ever. Like, I collapsed on the floor, and I thought, I'm going to die. Like, there's something really majorly wrong. And I don't know what it is. I was just doubled over in pain, and it was incredibly sharp, like a knife. And I called my husband, and the only thing I could think was, oh my gosh, it was in the area where my ovaries are. So I was like, cyst must have ruptured. I've heard that they're incredibly painful. I know that if you start bleeding, they can be life-threatening. And I was in that much pain. And so I called my husband in there. I was like, help me. Like, you have to help me. Take me to the ER. And he was like, well, why do I need to take you to the ER? What's going on? And I was like, well, I don't know. And so he put me in the bed, and I laid on one particular side just to try to get the pain to stop. And after like 30 minutes, it didn't stop, but it did ease up a little bit. I walked slowly to the bathtub, and I got in the bathtub, and I just sat there in hot water for a good 30 minutes to an hour. And eventually it just subsided. And because I didn't have any bleeding that I could see, so I didn't panic. I didn't wind up going to the hospital. But I would find out many, many, many years later that that's probably the day that the coil moved and punctured through my fallopian tube.
Did you ever, like to this point, and even then, think it's the Essure? Did you ever even go there?
No, it didn't even cross my mind. I trusted them. I forgot it was in there. Like, it wasn't something that I thought about because I didn't know it could be dangerous. I didn't know it could move. I didn't know that when I moved that it moved and cut deeper. I didn't have any of that information. So I knew nothing other than the benefits of $50, permanent, no surgery. This is for you.
They probably get a lot of people with that.
Definitely. That's a selling point. That was the selling point right there. After like an hour and a half in the tub and laying down, it subsided enough that I was okay. Then it moved into soreness. And I thought, well, if it was something major, there would be other side effects. So I just went on with life. I guess we're pretty tough. You like deal with it. So I started having horrible lower back pain for the next 2 years. There was an episode where I could hardly walk. And it came out of nowhere. I was visiting family out of state and I had just had to lay on the floor. I couldn't even go out to eat with them. And it was just horrible. And I went to the doctor after that, a different doctor. So I was going for my low back and the doctor said, your whole body is inflamed. Like there's major inflammation. Why are you so inflamed? And I was like, I have no clue. Again, no Essure, like never registered that it would affect my back or cause inflammation or anything. After this doctor told me that, was looking at my back, I went to my regular doctor. She was like, yeah, I don't understand why you're this inflamed, but I need to put you on medicine for inflammation. I mean, like I was hurting.
Did you have inflammation markers that were high? How did they arrive at the fact that you had all this inflammation besides the fact that you told them?
Yes. Oh, well, I didn't know I was inflamed. He did x-rays and something else. I'm not sure. There was something with soft tissue. I'm not sure. There was tests run and perhaps blood work. I think my regular doctor would have done blood work because she wouldn't do anything. She would not put me on medicine until she knew. It's not like I could come in here and say, hey, I have inflammation. So yes, she definitely did some tests. My family doctor was like, yeah, I don't understand why you're this inflamed. Within a year, my hands and my arms started going numb. And I started to have some nerves acting up in my hands and my legs. So I went back to my family doctor and she said, it's just odd. Like the problems that you're having with neuropathy is something that we see in 70 and 80-year-olds. Like, I don't understand, you know, you're really young. But I would describe to her what was happening. So she had to put me on a medicine that 70 and 80-year-olds use. And it was a really strong nerve medicine. And it gave me some relief, but not mentally. My husband owns a business and he works specifically with much older people. He hears that particular prescription a lot. And he said, hun, like, my clients are on this medication and they're in their 80s. Like, why are you on this medication? And we began to realize that the numbness that I had was something that can naturally happen and does tend to happen frequently to people much later in life, like in their 80s. So I'm having it at such a young age, and this is some pretty powerful medicine. They put me on a medicine for inflammation to try to bring that down. And then they also put me on a medicine for neuropathy. So that was going on. But my family doctor is really wonderful, really young. She was pretty fresh out of college. So she's pretty gung-ho and we became friends. But also I was desperate to find out what was wrong, because if I'm on this type of medication at this young an age, what's my future going to look like? I don't even like to take medicine. Like, what am I going to do? And can I be on this medicine long term? I have a family and all of that. She was like, we're going to figure this out. We're going to figure out what's going on. In the meantime, periodically, I would have abdominal pain, but I began to have morning sickness. So it was very strange. It was like every year a new symptom came up and it was just odd. And so it was so bad. Again, I don't have health problems. I've never had morning sickness except when I was pregnant. It was so bad that I went and got a pregnancy test 2 different times. So I was like, I can't have children, but I'm pregnant. Like, that's how sick I was when I woke up. So
how far away are we from the Essure implant now?
We are maybe 4 to 5 years after implantation. So I started having morning sickness, and then you kind of roll everything out. You're like, okay, well, maybe I need to eat. But I mean, it was legit the same morning sickness I had when I was pregnant, the second trimester of my children. And I just thought, that's just bizarre. But every pregnancy test I took, of course, was negative. I was really worried about a tubal pregnancy. Like, what if something were to happen and they made it to the tube, but they couldn't make it past the coil, and then I'm going to have a DNC? That type of thing bothered me. I had heard of things like that happening and babies dying because of it in situations like that. So I was very scared. But I learned to just deal with it. On the days that it happened, I just had to get up and I just shrugged through it. Because I was like, I don't know what's causing it, but if I can make it past the first hour without vomiting, I'm okay. So
And
I
it's
get some
so
water.
hard when you're that type of personality because you just try to keep soldiering on and you know something is really wrong.
Yeah, you just push through. I might say to my husband, I don't really feel well. But if you looked at me, I looked great. I was in shape. Yeah. I was working like crazy. And he's like, you're good. There's nothing about me where you would think, oh gosh, something really terrible is happening. And I'm trucking through, like you said. So I don't blame him, but I think it's easy to not be taken seriously when you just push forward and you kind of can hide that you're hurting or dismiss your own discomfort and say, I can handle it. I'm tough. I got it. So in that way, I just really never even talked about it. I didn't want to be a complainer. Right. I didn't want to be labeled that way because I just literally do not complain. It's not in my DNA. So I just kept suffering. And then, crazy enough, like I said, I have really good skin. All of a sudden, I started getting these incredibly painful cysts on my chin.
Right.
I would get cystic acne, which I know now is hormonal acne. Obviously, where this device is implanted, it's going to mess with my hormones. I mean, it's right there in the reproductive capital of the body. It was incredibly painful. And so now I had to go find another doctor because I'd go back to my gynecologist. Whenever I went to her, the only thing she would say, I remember going to her in her office one day and I was like incredibly overwhelmed. I was crying. I didn't feel well. I was working. I was doing all this. We just had a little therapy session. And she told me, again, she was very kind. And she said, let me prescribe you something. I don't know if it'd be Prozac or what. And she was like, look, you don't have to take it. But if you feel like you need it, you're having a hard day, don't feel guilty. And I kind of broke down at that. I'm not throwing daggers at anyone for needing medicine, but for me, it was defeat because I thought I have to find the root cause of this. I can't medicate it and cover it up. It seemed so disingenuous for me and it was hard. And I remember crying and telling her, if this makes me more likable, I'll take it. Because I was in so much.
You start to lose yourself because doctors are telling you all your tests are normal and you know that you're not normal. You know you don't feel well. You don't want to let the people that love you down.
Yeah.
But you feel like
it's
dog
pressure.
crap.
Yeah. Feel really bad.
And every day is a grind.
And it was. And then you feel like you're going crazy because it's like, why do I feel pregnant and I'm not pregnant? Why do I have morning sickness and I'm not pregnant? Why am my ankles and my knees and my elbow, all my joints, that's where I had all the inflammation. Like, why are they hurting so badly? Why can't I feel my hand at night when I lay down? Why are both hands going completely numb? Why? So
and you're like, is it MS? Is it cancer? Is it Parkinson's? Is it ALS? What do I have that they can't see?
Right. Because all your friends, you're all around the same age and nobody's having any of those symptoms. So it's not like it's a natural process of aging. And you just feel kind of alone, I think. So I started crying and I said, if it makes me more likable, like if it makes me easier to be around, because for my husband, I think I was going through so much that I was very irritable. I didn't realize it, but I think I was. I remember going home and I just felt defeated and I took a pill and it did mellow me out, but I wasn't myself. I'm a high strung person. I'm high energy and I have a lot of personality and it made me not care. Okay. I'm not the person that doesn't care. Like I'm very active in my community. I'm very active in nonprofit organization work. I'm very concerned about people. It made me not care about anything. And I took it for a week and then I flushed them down the toilet and I said, that's not me. I can't do it. I'm going to have to figure this out because I can't do it. I can't change who I am. To be more digestible when there's something deeper going on. So her recommendation after that was a hysterectomy. If I said anything, it was like, let's just do a hysterectomy. And I was like, I don't want to do a hysterectomy. I'm young. And I'm like, I don't want a hysterectomy. Like, why would I have a hysterectomy? Or let's put you back on birth control. Well, I don't want to be on birth control. You told me I didn't need birth control once I had this procedure. My ovaries are just fine. Why are you trying to put me back on the pill? Right. So that became a bit of a battle. And so she said, well, if I put you back on the pill, it'll fix the cystic acne on your chin. And I was like, okay. So I went back on the pill, and I wound up reaching out to a dermatologist. And she was like, we actually have a pill that cures that type of acne. It's a fluid pill. I can put you on it. She put me on it. The low dose didn't work. I'm on, and I'm still, this is the only medicine that I'm still on, by the way. Mm-hmm. She put me on a really high dosage, but it worked. So I went and got off birth control because I didn't need it. Okay. And this particular fluid pill cures hormonal acne. It's wonderful. I am on a pretty high dosage, but it goes back to hormones. And so I don't know if my hormones will ever be back to normal. I've tried to get off that particular pill 6 times and it doesn't work. So.
But you've had the Essure removed, right? So we haven't even gotten there yet. Even still, you have the acne and you still have to remain on this medication.
Yes, I have not been able to get off. I started having numbness in my arms and legs, nerve damage, and all of that. Also, oddly enough, at some point, I started getting a rash on my tummy on both sides of my belly button, right where the Essure is implanted.
You still never thought Essure. You'd still
never thought Essure.
Oh my God!
I thought it was my soap because it was random. I thought maybe I used a soap that I had a reaction to. And then one time I thought, oh, I got my shower water way too hot. That's why, because it wasn't there all the time. It was almost like a flare up. And, but yeah, it was on each side of my abdomen. And then every now and then I'd have a really painful patch on my neck. So painful. I couldn't touch it.
Like shingles.
Yes. It was crazy. I've never had chicken pox, so I can't have shingles. Oh, another side effect. I don't cut my hair. So I know like some people would say, well, how can you really tell that you had that much hair loss? Well, I don't cut my hair. The last time I ever cut my hair in my entire life was in the 3rd grade. When I had the device implanted, I had very long hair. It was below my waist. And by the time my ordeal was finished and I had it removed, it was to my shoulder blades.
And you didn't cut it in between? No trim, no nothing?
Nothing. I did not cut my hair and I did not trim it, burn it, nothing. It was a big deal. It was coming out in fistfuls in the shower. I thought, oh, it's my hormones. I guess I'm getting older. People are saying they lose a little hair. But I was with a relative and I was making a cup of coffee and I turned my back to this relative and they screamed. We were in the kitchen and they screamed and it scared me. And I turned around very quickly and they said, what happened to your hair? I was caught off guard and I just kind of reached back and grabbed my hair. And I said, well, what do you mean? And they said, where's your hair? And I said, well, it's falling out. It's been falling out. They were so shocked. It had happened gradually, but I had not seen them in a little bit of time. When I turned around, they were just shocked at how short it had become.
Wow. And now a word from our sponsor. Attention metalheads, are you struggling with skin rashes, joint and systemic pain, or fatigue that just won't go away? Type 4 metal allergy is often overlooked as a culprit in many of today's chronic illnesses. Get to the root of the problem with ELISA testing. ELISA is a scientifically proven and clinically validated test that measures immune reactivity to metal allergens like nickel, cobalt, and titanium. With fast and reliable results, you can get the answers you need to find relief and live a healthier life. Don't let metal allergies control your life any longer. Visit melisa.org to learn more and schedule your test. Trust us, you'll be glad you did. Melisa, a valuable diagnostic tool in medicine.
I do know that metal allergies, that's one of the side effects. I also had some other symptoms. One day I went to the bathroom and I went to use the restroom. And I looked down and there was bright red blood. So this is not normal. This is not like menstrual cycle. Sure. This is like someone just cut you and you're bleeding. And that was really bizarre to me. And it really concerned me. And I thought, okay, that's not normal. I mean, it was like bright red trauma blood, and like I'd been stabbed. And I called my doctor and was like, yeah, I think I need to come in.
Did you go in to see the doctor, and what came of that?
Yeah. I called for an appointment. It takes a little time to get in. But in the meantime, I was also having pain during sex, which wasn't completely abnormal, but it was different. I would hurt for a long time afterwards. And then I started bleeding afterwards. So that was completely new.
Was the pain up closer to where the ovaries were located?
Yeah.
Okay.
It was like severe cramping, just really bad abdominal pain for days. It was pretty bad. And it's like not comfortable. And then, of course, bleeding. Nothing crazy. It wasn't like hemorrhaging or anything, but I never had any problems in that department. So to have any blood after sex was really something new. Wow. And not good. And after that situation with the bright red blood, I thought, okay, something's wrong. So I made the appointment and I went in and I began to tell them my symptoms, and they said, okay. And then finally, years later, I was like, by the way, I have Essure. Maybe something's going on with that, because the bright red blood, I think, cued me to something cut me internally. Yes. And I think that's the first time my brain went, you got something metal in there. So she was like, okay, let's do a vaginal ultrasound. Let's check them out. Let's see if they're okay. She takes me in the back. Now, this is not my regular gyno. The nurse practitioner was there that day. And then, of course, the ultrasound tech did it. She does a vaginal ultrasound and she's like, yep, I see both of them. And they're where they should be. They haven't moved or anything. So it's not that. And then I told her about the time I was on the floor in excruciating pain. And she was like, yep, it's probably a cyst. A cyst probably ruptured. And I said, okay, well, that's exactly what I thought. Everything's good.
Okay.
So I go home because there's nothing wrong. And I just deal with what I've got.
Yes.
And the next thing I know, a friend of mine reached out to me and said, I'm having issues with my period. I'm having issues in this department. And she was telling me that she had a device, whatever, it wasn't Essure or something else. And I said, you know what? Maybe you should have Essure. I had it a really long time ago. No problems whatsoever. It's worked for me. It's a great
you were
thing.
Still saying no problem whatsoever.
No problem whatsoever. Because remember, they did the vaginal ultrasound and I'm good.
Yeah.
They're in place. It's a cyst. So I'm over here promoting this product. And I said, yeah, ask your doctor about information. She said, I will. I definitely will. I said, you know what? Wait a minute. I was in the Walmart parking lot buying groceries, going to buy groceries. I said, I'll get it for you. I'm going to look it up, Google it. I'm going to send you a screenshot and I'm going to give you the information. Because when somebody asks me for help, I am just a helper. I'm like, I'm going to get it for you.
Yes.
I'm walking into I've got my buggy and I Google it as I'm walking. And the first thing I see is like lawsuits, things going wrong, deaths, banned, black labels. I just stood there. I was dumbfounded. And it was like I was run over by a truck and I had to buy groceries. And I'm over here and I'm just thumbing through these articles in the produce section of Walmart. And I'm like, removed from the market, women dying. And that was a gut punch that I never saw coming. I mean, like I said, it's weird, but I had to go buy groceries. Like I had to finish my normal afternoon. My head was spinning like 90 to nothing. And I was like, people are dying. This has been removed from the market. Nobody told me that. Nobody sent me a letter. Like, when was I going to learn about that? And I mean, I really can't believe it. I'm in disbelief. I finished my grocery shopping. I get in the car and I call my friend and I'm like, you can't have this procedure. It's been outlawed, like worldwide. And it's like all I can say. And she's like, what? You know, I think she's like taken back. And I'm like, well, I just Googled it and this is what I found. I said, I don't really know what to do. And so I went home. I had to go to work the next day. And so I'm just like, you know, I'm functioning and I'm in a totally different headspace because in the back of my mind, I'm like, am I going to die? Because all of these symptoms are coming back to my mind. Like, these women have died. Am I going to die? Like,
Yep.
am I going to have cancer? Did this cause?
So the dots connected in the Walmart produce section at that point, you knew.
I did. I knew. And I didn't cry. I was in shock. I legit was in shock. And I went home. And for the next week, I went and read articles. I went and read news articles. I went and watched the documentary, The Bleeding Edge, which documents this whole situation. I was reading about all the lawsuits. I was reading about all of these symptoms, and I'm seeing myself in all of these. And after about a week of reading, it hit me, and I just started crying. Like, I'm an intelligent woman, and I felt taken advantage of for money, and I felt betrayed. And at the time, I didn't know if I was going to die or not. And a lot of people got really rich off of my ignorance. And I didn't know any better. And that was really hard.
And you lost time with your family and your husband and your life that you can't get back.
Right. And it is difficult when you're going through things like that. And I read story after story of women who had gotten divorced. They had lost their husbands. They had lost their children. They had lost their jobs because they couldn't perform their job duties. And you have these people who are selling you essentially for a profit, and you're not aware. I felt that I had been taken advantage of in the worst kind of way. And I've never felt that way before in my life. And that was very difficult for me. She had delivered my children, and I couldn't believe she would do that to me. So that was really hard. And then I had a choice to make. And I said, okay, what do we do now? So I decided I'm going to call her, and I'm going to ask her, will she be honest with me? And I don't think a lot of people do that. I think they probably go seek help in other ways, but I needed to talk to her. So I made an appointment, and I was at my work, and I was like, somebody's going to have to do this really quick. I need to leave the room. I need to go call someone. So I called, and I talked to the secretary. And what's funny is I called and I said, I'm a patient who had Essure, and I've seen the documentary, The Bleeding Edge, and I have all of these symptoms, and I'm on medication, and I need to talk to the doctor. And she was like, please hold. So she goes and gets a nurse, because she's just the secretary. The nurse gets on there, and I'm so emotional because I'm like, y'all know these things. So I'm kind of approaching it from the standpoint of like, are you aware this is what's going on? I still want to give them the benefit of the doubt. I want to believe that this is a mistake. You wouldn't do this to me. I give her the whole spiel, and I'm like, I need help. And she's like, okay, we need to get you in. And keep in mind, this is a booming business. I told you the last appointment was for bleeding, and I didn't get in there for a minute. She was like, can you come tomorrow? So I'm like, yeah, but I was like, God, they're willing to get me in the next day. So I told my husband, I was like, I need you to go to this appointment with me because I'm nervous. I'm scared because I'm going to ask her about this thing. And what was really bothersome to me is I had seen how long it had been pulled from the market. And I wanted to know why she had not sent letters to every patient she had implanted it into. That was my concern. Like, if you had done this, and then the FDA comes back and says, this is dangerous. It's got a bazillion lawsuits. These women are dying. You can't do this procedure anymore. Don't you think it would be common decency to send a letter to every woman you put this into to let them know, hey, this is some new information? That never happened. So that was
no offense. The FDA and common decency don't really go in the same sentence.
No, they don't. They're the same people that approve the device. And oddly enough, if you've done any research on it, once they decided to pull it from the market, they pulled it at the end of a year and told them to hurry up and get rid of all their stuff. So they implanted probably double that last year to get rid of their products so they didn't lose money. Oh. Like, we're pulling it from the market in December, and they're letting you know this in January. So you got one more year to get rid of all your devices in your office. How horrible is that? It's
Wow.
beyond awful. So I made the appointment. My husband went with me. I checked in. I've been going to this particular doctor for years. They delivered multiple children. They're sweet. And they met me, and it just was a different feeling. And they got me back there very quickly, and they said, he can't come with you, my husband. He can't come. That was bizarre. And I didn't know what to do at the time. And I was like, okay. I needed to have this conversation. So sent him, he had to wait in the waiting room, and I went back there, and she comes in, and I'm going to try to remember this conversation because I was so emotional, because it's difficult to confront anyone. It's difficult to be emotionally charged by it, to be wounded and hurt. It's difficult for them to be your doctor and professional, and you feel less than intelligence wise, and you wonder, how are they going to react? Are they going to get defensive, or they're going to empathize? I don't know what's about to happen in this room. So she had read my notes, but this is the mistake she made. She said, well, let me check your chart. Because I began to tell her, okay, I was having all these symptoms. I came in, they did a vaginal ultrasound, and they said everything was fine. She's reading my chart from that visit. Remember, that visit had happened a year or two prior. The nurse practitioner did the vaginal ultrasound.
Yes.
She's reading the notes out loud, and she says, oh, it says here she can't locate the left coil. That's not what the nurse practitioner told me when I was there, but she put it in her notes. I'm sure my doctor regrets saying that out loud because she was just reading the notes out loud. That's one of those moments where you're like, probably shouldn't have said that, because I called it and I was like, wait a minute. She didn't tell me that. And anyway, we went into this conversation. Basically what she said was, I think you know more about this than I do. I haven't done a lot of research on it. That's what she told me.
Oh boy.
She said, you've obviously had time to do research. Basically, she didn't, because she was full-time OBGYN. She just said, you know what? We can do a hysterectomy, get them out, take care of it. She really wanted to get it out of the way. I wanted to know why she had not informed any of her patients, right? So we have this conversation. I probably don't say everything that I'm saying now. I was much younger. I was very emotional. I didn't have any support in the room. I had two people there and just me. But we did have the conversation. She said, I can get you set up for hysterectomy. We can fix it, essentially. And near the end, because I didn't know what to do, she asked the nurse to walk out. She said, you can go. I'm okay. So the nurse walks out and leaves just she and I in the room. And she looks at me and she says, I believe you. And I just started sobbing, because I know that I don't think that she's malicious. I think this really is probably medical negligence. I don't think that she had any malicious intent. I think that she trusted the manufacturers and the people who pushed it to her. And she didn't probably do enough research because she doesn't have time. I know she believed me. She told me she believed me. I don't think she could say that in front of her staff. I think she just wanted to fix the mistake, and she knew she had made a mistake.
Did she apologize, legitimately apologize, or she just said she believed you?
Yeah, I don't remember an apology, but I don't remember a lot, but I think I would remember that. And I don't remember an apology, but I would say her tone was sort of apologetic, I guess, as much as she could be, because honestly, she would have had to admit that she made a major mistake and very negligent. And for lawsuit purposes, I don't really know that the doctor wants to do that. I don't want to say that she was horrible to me. She wasn't. She listened to me. I think she just wanted to remedy it. But when everyone left the room, she said, I believe you. I was sitting there and it was like, I know these things, but also I'm unsure. And I think she knew that I knew, but at the same time, you don't want to believe it. You wonder, will other people believe me? Because I had people say, do you really think all of those symptoms are from that? No way. That's not possible. Every time you have a problem, you want to put it on that. So you begin to doubt, and you're like, well, I'm not trying to find the fall guy for every single symptom, but I was really normal until this.
Right.
And then these weird things start happening. So she said that. I left, and I had a lot to think about because she wanted to schedule a hysterectomy. Well, I went back to my friends and they were like, absolutely not. No, they said, when you get in there, when she gets in there, if something's wrong, do you think she's going to have the integrity to tell you? Absolutely not. They really question. They're like, I would never go back to the person who did it, because what if they get in there and they're like, that coil caused irreversible damage? Do you think she's going to come out and put that in the report? And I was like, you're right. I can't. I'm not saying that she wouldn't do right, but I am saying that probably by nature, if something atrocious was in there, they're not going to come out and say.
Right.
So I had to make a decision, and I had to find a specialist. And that's exactly what I did. I had to reach out to a specialist. I found a support group for ladies who were dealing with the same problem. And a couple of different doctors' names kept coming up, and one just really rose above the rest. So I called. I have never in my life had that type of experience with a specialist. I literally called, told him what was happening, and she was like, I'm going to get you an appointment right now at your hospital to get pictures of those coils. They can't find one. We're going to find one. That was the same day.
Wow.
And I never felt that taken care of in my life.
Wow.
I will sing the praises of this man and his office probably forever. Forever.
So you call him. That's the first visit. What's the next step?
Yeah. So I call him. They do a more invasive. They don't do a vaginal ultrasound because they said sometimes you can't see the coils on those. So they did a different type of x-ray scanner test at my hospital, got those sent in. And the next day they called me with the results, and they were like, well, they seem to be in the right place. So that's good. And I was like, I have to get these out. And so we immediately began talking. This is far away from me. So he made an appointment, called me over the phone. We discussed everything going on. He was like, how would you like to do this? There were several different options for how to do it. Mm-hmm. Like, do I want to keep my cervix? Do I want to keep my ovaries? Do I want all of this to be pulled through my belly button? Just a lot of decisions. So I started doing some research, and I decided that I would keep my cervix. But because I wanted to do that, the surgery was very tricky. There's not a lot of doctors that can do it. I was actually incredibly blessed, fortunate that I found out later as far as what was going on in my body. Some of the women who found out a lot earlier were subjected to doctors who didn't know how to get them out properly, who didn't really know what they were doing. They had doctors go in there and try to extract them vaginally without putting them to sleep. And you're talking about basically ripping out organs. They would go in there with pliers and they would pull those coils, but like our entire body was embedded in those coils. So there were women who were maimed. There were women who died from that. So I speak about this part with a lot of reverence because there were a lot of women that went before me. My heart goes out to them and their families because they found out sooner, before technology had come along, before doctors realized, okay, we can't touch these coils. You can't pull these out. You can't cut them in half. You can't do anything like that. You can't even touch them because if you cut them, they expel metal fragments into the body that cannot be retrieved ever. Like you're never going to get that out.
Right.
So doctors had to spend years trying to figure out, how do I extract these in the safest way possible and maintain as much of the woman's organs as I can. And then some women wanted to have babies and they like had to figure that out. So I had to talk to him and figure out how we were going to get it out. For me, I wanted to keep as much of my body as possible. So we decided on taking my tubes in my uterus. Now, this is before he's went in, right? So we know they're there. They look like they're in the right place.
Yes.
So I'm like, I want to keep my cervix. You can take my tubes and my uterus. Well, if you keep your cervix, you can't pull anything out vaginally. Everything has to come out through the abdomen. So he had to cut my belly button. Of course, I had several different cuts on my stomach, but he had to cut my belly button quite larger. He did it via the Da Vinci, which is a robot.
Yeah.
He had to go in there and he extracted around the tubes, and then he put them inside my abdomen. He put them in a bag and he had to chop them up into little pieces and pull it all out through my belly button. So he wound up having to cut my belly button twice the size that he normally would need to, because he had to pull all of that stuff through my belly button. So I got me a nice new belly button. It looks okay, but my belly button was really cute. It's not atrocious, but it's not my original belly button. It was a lot of trauma to my abdomen. I didn't realize how much trauma that was going to be.
That's your first real surgery at this point.
Actually, a year prior, I went in and had 5 surgeries. I had several ENT procedures, all done at once. So that was my first experience with surgery.
Okay.
And that was not fun at all. So we go in and I had to go a long ways. And when I show up, we met, had a consultation, all that, and go to the hospital the next day and I have surgery. And again, I don't know what it is, but they're fixing to wheel me back to surgery and I'm ready. I mean, I'm nervous, but the anesthesiologist comes in. I just start crying. I don't know. I think because I'm like, oh God, I'm going to die on the table. This was way more major than the ENT surgery. And I was like, I don't really know what's going to go on. I think they just feel really sorry for me. Thank God that he puts people in my path that are very nurturing and motherly because they're like, you're going to be just fine. Like, please hold my hand. So I do that. I come out, everything went great. But when he came in, he was like, yeah, one of your coils had migrated out of your fallopian tube. So it cut through all of that tissue and it was embedded now in the side of the uterus. So it had went out of where it was placed, cut through. And then what's crazy is I had heard, and that's why I was concerned when they couldn't find it. They said that it migrates because our bodies move, those tubes move, and these coils don't. So when we move, it just cuts through that tissue. And eventually a lot of ladies had their coils migrate and land in their bladder or their lung or their heart. And that some people had died that way because whatever it happened to land on, it embedded itself in it. So some of those things can't be surgically removed and it just keeps cutting away. So anyway, that made a lot of sense to me. The bleeding made sense. The pain made sense. And I'm so grateful. Again, I made the right decision getting it out. I don't know where it would have went after that. Before I went in for surgery, by faith, I was like, I'm done with this medicine. When I come out, I'm going to be good. And I got rid of my medicine 2 weeks before I went in to have that surgery. And I've never taken a pill for inflammation. I've never taken a pill for neuropathy again. My hair is back down to my waist.
So how far since you had your Essure removed, how fast did the symptoms start dissipating? And when did you know you were different?
I knew I was different. This is going to sound cliche, but I know of other ladies who've said the same. I knew I was different when I woke up. And I don't know if it was so much as a mindset, like I'm free. I think it's a combination, but my body felt different. I don't know if it's that the first time my body didn't have a foreign object in it that it was battling against. I think my outlook was incredibly positive when I came out because it was like, whew, I survived it and I survived surgery. I can beat anything. I had to get up and start walking and all that. But physically, like I said, I never had to take another pill. I went home with a pain pump in my stomach that had to stay in for several days. It was a tube that came out of my stomach right underneath my belly button, about an inch, because I was nowhere near the surgeon. And I only stayed there for 2 days and he sent me home. So it was interesting. I don't know if you've ever seen one, but it's like the size of a softball and they put it on you like a crossbody purse and it's inside my stomach. And he's like, this is going to dispense pain medicine in your stomach every 2 hours automatically. You don't even have to think about it. And after a couple of days, it'll be completely gone. And this softball size pain thing will be deflated. It will have dispensed its last dose of medicine. And when that happens,
how do you get it out?
You pull that sucker out.
Is that routine with all the patients?
It is for patients who don't live anywhere near his office.
Wow.
The only thing it was pretty interesting. I was like, okay. The only thing he said was when you go to pull it out, if you get to a point where there's any resistance, do not pull anymore. Go to the hospital. So in the back of my mind, I'm like, oh gosh, what if this
another foreign body?
Yeah, I was like, what if it gets hung up on an organ? You know what I mean? Like,
oh yeah, I mean, ripping out my intestine or something.
Yeah. So a couple of days after, it was completely deflated. All the medicine had went in. My relative was visiting. They were helping me. And my husband was like, yeah, I don't want to pull that out. And so they were like, I'll do it. And I said, okay, well, I want to film it. So she begins pulling it out. And I thought it was like 6 inches long. No, she starts pulling and pulling and pulling. And I'm starting to get worried. I'm like, oh my God, how long is this? And it's kind of funny because you get to a point where there's like a little blue line on the cord. And that's letting you know you're coming nearer to the end. And this is disgusting, but we talk about everything else. At that point, juices start coming out with it because,
Oh,
I mean,
that's nice, right? Oh.
yeah, it was clear though. It wasn't like infected or anything, but it keeps pulling. And then at that point, I feel it and it's inside my stomach. So it's kind of tickling like the end of a rope as it whips around inside of your body, getting ready to come through a really tiny hole. And she gets there and there's just like the tiniest bit of resistance. And I'm like, no, stop. And she was like, no, I think it's okay. I think we're fine. And sure enough, she was just pulling it through those last few layers of skin and flesh and it popped out.
And it didn't hurt when she was pulling it out?
No, it tickled.
How long was it? I got to know.
Gosh, probably 18 inches or more.
You are Wonder Woman. You and all the others like you. That's amazing.
I don't know about that, but it was a really, really cool video.
Did insurance cover the procedure?
They did cover some of it. I had to pay a little bit up front. I was out of pocket a little bit, but it was a very expensive procedure. I think I wound up paying like 10 grand. Okay. Personally.
But you'd probably do it all over again.
I'd do it all over again 100% because I got my life back. I got my body back.
So how long was it total that you had the Essure in your body?
Between 7 and 8 years.
Did you see any of it? Do you know if it was corroded? Was it obviously not intact by the time they took it out? Did he comment on it?
I did see photos. What he does is some people, he actually gives you the coils. Like you can keep them. Some ladies have their coils. I don't remember. I don't think I got them. I don't know that I asked for them, but I did get photos. He took photos during the surgery before. I saw them in my tubes. I saw them sticking out. I saw all that. And then they sent me all the photos of afterwards, everything they cut out and they burned and what it looked like and everything. And of course, I got the operative report and I got all of that.
Have you ever reported back to the original gynecologist?
No, never. Not after I talked to her in the office that day. I knew I would never go back to her for a hysterectomy.
Do you feel like it might be helpful to update her with the resolution of all your symptoms?
I don't know. Honestly, when I walked out of the office that day, I just thought, well, that relationship ended. It was very sad for me because I wanted a gynecologist that would stick with me forever. We don't really have a lot of great health care as women after the childbearing years. There's not a lot of people who really, I feel like, look out for us in our post baby years for cancers and all this other stuff. We kind of get put on the back burner. I was really upset that I felt like I'd lost an advocate that I'd have for life because I'd told her many times, I'm going to grow old with you. And, you know, I felt like she'd be somebody who'd fight for me. If she found out I had breast cancer or cervical cancer, she would go through it with me. And I lost that. And so I just never went back because I knew once that trust was broken, I just couldn't do it. So I never felt the need to go back and update her. I didn't think it would make a difference.
The reason I ask, you probably haven't had time to see my story yet, but right before we got my actual diagnosis, I went to a lady who is board certified in internal medicine with a fellowship in allergy, immunology, and rheumatology. And she said, I don't know what's going on with you. You can't have a metal allergy. She signed the test requisition just because I drove 2 hours to get there. If I would have listened to her, I would have been dead. But honestly, not just her, but I actually feel the need to go back in and pay for the visit to tell them how it turned out. Because that's just how I personally feel, because I feel like if I don't do that, then they don't know. They don't know. It's just, there's a patient that was unhappy that left and they don't know that, hey, it wasn't in my head. There was resolution, full resolution. And here's what happened. I would never go back to her as a patient. And that relationship, like you said, was severed. But personally, I feel the responsibility. I have yet to go back, but I will go back, or at least write a letter or do something to let them know the other side of the story.
Yeah. Well, it's funny you say that. I never thought about it. You've given me something to think about because I really do believe at some level she's aware. She was informed and it was removed from her office. So I felt like at that point she knew. She had just probably never been confronted with it. When I found out all this stuff, I did go to my family doctor, the young one that was trying to help me find everything. And she was like, keep me updated, call me, text me, whatever. When you go for surgery, let me know. So I went back to her and I was like, can I please give you some pointers for some of your paperwork? I said, somewhere on your paperwork, you need to have Essure on there. And I told her why. I said, because you're going to be working with women and you're going to look on there and not know that they've ever had surgery because they're going to check that no box just like I did. And I said, you're not going to know. You need to put an Essure part on there. You need to put that on your paperwork. And
it's not just you, it's all the people walking around. I've run into several people. My first question, if they have chronic pain, is, have you ever had any jewelry allergies? And they say no. And then I dig a little deeper and they're like, oh yeah, I did have that earring thing. And then I said, have you had any surgeries? Yeah, I've had surgery. Do you have any metal? No. And then I asked them what kind of surgeries, and it's metal.
Yeah.
And they don't know. So I kind of feel like our goal, having suffered and come out, we all have different stories, unique experiences surrounding metal hardware and metal allergies. But I feel like it's our responsibility to go back and tell the story, not just for the patients, but for the doctors. If we leave their office and they think we're crazy and cuckoo for Cocoa Puffs, and then we go get our hardware out and we make a full recovery and we never come back to tell the story, they never know. Right?
Yeah, right. I did inform multiple doctors, but not her. I did. But now that you mention it, I might make an appointment to talk to her about it.
I think it's one story at a time and one patient at a time. And that's the goal with the podcast, is to tell these stories so it changes. And I'm so glad that you had the courage to come on and be my first patient that hasn't shown their face. The story speaks volumes, and the face doesn't matter. The story matters.
Right. Can I tell you something really quick? I almost forgot this. The morning that I'm in for surgery at this hospital, I'm really scared. When you're going back for surgery, there's just a curtain between you and the next patient that's going to be going in. I hear some of the questions. Me and my husband just kind of eavesdrop because we can. We're sitting there and not doing anything.
Right.
And before you go back, they list what you're having done. And then they say, because of these symptoms. And that was the first time that I heard someone. We were married for the same amount of years with the same amount of children. We had it done the same year and we had the same symptoms, except she was incapable of walking. She had lost her ability to walk. And I looked at my husband, and for the first time, I felt validated. And I'm not throwing shade at my husband. We never met anybody who had it. We never met anybody who had it implanted. We never met anybody who had any of these symptoms. And I just know that at some level, maybe there was doubt, because it's not your body. You don't know. He got to hear that woman's husband talk about what she'd been through and that she couldn't walk anymore. And that was such a moment. I was like, I'm not crazy. I am here for the right reason. So when I got out of surgery and I was in recovery and they put me in my room, about an hour or two later, a woman walks in the door, and it's her. And she said, I just wanted to say hi and I wanted to meet you. And I think that day he had 7 scheduled just for that morning. Did you stay in
touch with her?
Yes, we are Facebook friends.
And can she walk now?
Yes, she is fully functioning and walking and living her best life. And her husband walked in and we all talked. And it was one of those moments. I don't know if you've ever had this. I never had it before or since, because I've never been through anything like this. But it was like, we didn't know these people, but they were not strangers, because that man had lived what my husband had lived, and I had lived what she had lived. And it was an instant connection, an instant understanding. And we looked at each other and said, we made it.
There's a gal that I adore, and she's the head of a Facebook group that I adore. She's the admin of this group, and she was my first friend that she's still trying to work her way out. But we were both bedridden and we were both really, really sick. And I just felt an immediate kinship and friendship with her. Her and the group got me through the first years of my diagnosis. It is just balm to the soul to find somebody that just gets it, because you can just look at each other, talk to each other, and you don't even have to speak all the pain and all the nights and all the doubts and all the self-loathing and all the grief for not being able to be there for your children or your husband in the way that you want to be. It's still very fresh. There's not many people that you have that bond. And it's like, if you know, that acronym.
Exactly.
Yeah. Yeah. Do you feel that screening for metal hypersensitivity should be done prior to surgical procedures? However, if they would have asked you if you'd had any prior metal allergies, you would have said no, right?
I would have. And I don't think I had metal allergy even while it was in me. I just think that it was a foreign object inside and it rusts, it corrodes. That metal breaks down at a temperature much lower than our body temperature of 98.6. So it was seeping metals. I just think it was at a level that was way beyond anything normal. I don't think I have a metal allergy, but I think if you stick something that disgusting and so toxic in you, you don't have to have an allergy to have a reaction to it. That's what I think.
Yeah. Dr. Julio Novoa, who's a gynecologist, I'm not sure if you're familiar with him. He runs a no Essure group. We had a big discussion about Asia syndrome. The Heavily Metaled podcast doesn't have to just be about metal allergies. It can be about metal hardware and foreign body reactions to said metal hardware. And you've been a perfect illustration of you can still have all the symptoms without the allergy. Yes. I guess the good thing is you didn't have the histamine reactions and all the histamine side effects to go along with that. You just had the pain, and not just, but you had the pain from this as a foreign body reaction. Yes. So yeah, you can have one or the other or both. And all stories are welcome and well represented here. I got to ask you one more question because we haven't gone there yet. And I don't know if you even know this is coming. So you're ambushed. What is your favorite heavy metal band and your favorite heavy metal song?
Okay, well, are you ready for it? I do not listen to heavy metal. However, I grew up in a house of heavy metal. So Metallica, I just love their intros. But of course, Enter Sandman would probably be one of the favorites.
All right, well, there you go. Okay. For a non-metalhead.
Yes.
That'll work.
I could do Sad But True.
You could do it all. You can do whatever you want. This is the interwebs. I'm so grateful you came on to tell your story. And I won't ask how people can find you because you're going to be our anonymous podcast guest. But thank you so much for telling your story. Everybody, I want you to know I've launched a new website. It's still heavilymetaled.com. But when you go there, you're going to find some different things. You can, number one, sign the petition to advocate for metal hypersensitivity screenings at hospitals and surgery centers worldwide. We got off to a good start. We need thousands more signatures on this petition. So there's a button right there. When you go to the website, you can click, sign the petition. You can share it. You can print out a flyer to take to your medical provider's office so other people can sign it. This will make safer surgical procedures for all patients when they are asked ahead of time if there are any metal allergies or metal reactions that providers need to be aware of. So that's the first thing. The second thing is I have an email list and a newsletter. You sign up for that, you get a free metal allergy bundle. It'll give you the next steps on your metal allergy roadmap. If you're new to this allergy and are trying to navigate your way through, it'll give you a symptom checklist, and there's a great resource page there. And all of the podcast episodes are on the podcast page on the website. So it's literally your one-stop shop to stop and get all things heavily metaled. If you can, please leave reviews online, comment, like, share. It helps the algorithm put us in front of more people. So Maria and I are going to sign off, and we are going to continue to be part of the movement to change the medical narrative and to tell the medical industry that we're not going to take it anymore. Thanks, Maria.
Thank you so much.
Thank you for tuning in today. Please don't forget to follow me on social media and to like, share, and subscribe. My primary mission is reaching out to others who may be suffering from hypersensitivity reactions to metal implants and pointing them to resources that can assist with hope, help, and healing. If you know someone that suffers from a chronic illness, you might ask if they have any implanted metal hardware and if they've ever had a reaction to jewelry or metals of any kind. Might not even be on their radar. Visit us at heavilymetaled.com where you can find images and documentation relating to our show today, as well as a number of valuable resources and links to assist you on your own personal healing journey. Until next time, keep on rocking.